From a Macmillan perspective, we support people from diagnosis, and what is really, really important for us around the patient perspective is the fact that actually cancer isn't just a medical issue, it's very much a social issue. So people diagnosed with cancer have needs around the personal, practical, emotional, financial, work and finance, social isolation. And actually, so it's really important for us to be at things like this, to really demonstrate the holistic nature of cancer, and that how that we as an organisation can work collaboratively with other organisations to make sure that people do get the right support when they need it in the right way. Trish, who's based in Glasgow, will also talk you through a really great example of improving cancer journey, which is sort of a holistic model of integrated care from health into social care, and also around community assets and building that, which is really important for some of the work that I'm looking at about how you make those seamless transitions, and there's not just a cut-off point once you go from one setting, the boundaries that we as organisations and systems have created, but actually we see people as people and the journey that they go through. Also to add, although Trish will give you a tangible example, we've got a lot of work across the UK around system redesign, which is really taking big system leaders and thinking, how can we do this differently? So we've got examples of clinical follow-up, so how we make sure that people who are able to self-manage don't have to come back into the queue, but also things around what we call our recovery package, which is basically a set of tools of what we would expect the average person with a diagnosis of cancer to get an offer around a holistic needs assessment, which is essentially a conversation about what matters to you and the right referrals in, and it's also areas of where we can share data better, so be it between acute, primary and community, so that people the information follows them, and so that people don't have to tell their story more than once, and so that therefore it's not a really fragmented system.